Namaste and welcome to all participants to yet another session of Gurukula, 22nd session of Gurukula. So today we have with us Dr. Jishnu Narayanan. So on behalf of all of us and the family and on behalf of all the participants, I take the privilege of extending my cordial welcome to Dr. Jishnu Narayanan. I'll give a brief introduction of Dr. Jishnu. Dr. Jishnu Narayanan worked previously as a senior medical officer at AVP Coimbatore from 2014 to 2017, and ever since he has been working as associate professor at Astangam Ayurveda Medical College, Palakkad, Kerala, having an extended experience in teaching profession as well as clinical practice. Dr. Jishnu Narayanan is here to present his topic on exploring Prayoga Samuchayam. So when we were discussing about this particular topic, so I was really pleased with what Dr. Jishnu Narayanan wanted to present. This is a rare book, a Kerala text on Agada Tantra. So Dr. Jishnu Narayanan also holds a post-graduation degree in Agada Tantra, and as I already said, he is working as associate professor. So meanwhile, kindly let me admit a few of our participants. So exploring Prayoga Samuchayam will be the topic. So Dr. Jishnu Narayanan will be taking us into the depth of the oceanic treatise of Kerala text of Agada Tantra, and he will be exploring few formulations for us which we can use in clinical practice. The topic will be exploring Prayoga Samuchayam, a Kerala text of Agada Tantra from perspective of clinical practice. Without wasting any time, I would like to hand over the dais to Dr. Jishnu Narayanan, extending a cordial welcome once again. Dr. Jishnu, over to you.
Thank you, EC Ayurveda, for giving this opportunity. So basically, the presentation I'm going to do is a Prayoga Samuchayam, a Kerala text of Agada from the perspective of clinical practice. So basically, I'm not intending to do a book review, basically, because this book is based on Malayalam. It is being written a bit far, maybe few centuries ago. And I don't want to go into the depths of the idea what they are trying to communicate in the text as a general, but more rather than what I want to do is basically getting few of the insights from the textbook where we can actually use those ideas or those formulations or those practices into day-to-day practices of our general clinical practice. So basically, this would be helpful for those practitioners or those budding doctors who want to try a bit extra from the general, whatever we know about Ayurvedic formulations and other thing. And this thing will be, most of the formulations what we will be discussing through this presentation will not be available at the market, as we were already having a few discussions in the Ayurveda group that which medicines and from where we will be getting. So that part will be a bit difficult for us, but of course, this will give some light into few of the formulations which actually are wonderful and which is practiced by many of the Vaidyas and can be included into our armory for a better result. So basically, all the yogas what I want to discuss here are in the inverted this thing, it is experienced yogas. For example, none of the yogas which I will be presenting in the presentation will be taken from the text as such without any prior experience, because I'll let you know how this experienced yoga will be coming into scenario. And I'll be selecting very few formulations by from which only the mostly available and common drugs will be included, because we know again Agada Tantra is such a vast subject and very practically oriented subject which have most of the regional drugs and regional herbs, which finds at times difficult to identify, difficult to exactly pinpoint which is the drug. So there are so many controversies. So I'm omitting out all such scenarios, and I have taken only those formulations which is made up of common available drugs which has been experienced by many of the Vaidyas and are experiencing till now with their treatment clinical practices. So I will limit the presentation into only such yogas. So I'll just skip this slide because you know that Agada Tantra or Visha Vaidya will be having a huge scope in when we deal about a general clinical practice, because we know we are dealing with Visha in Agada Tantra and it is very potent. So the medicines what we use to treat the Visha, that also will be having very very potent and very fast acting properties will be there, which actually, if we can utilize those aspects into our clinical practice, the speed of the recovery or the pinpointedness of the treatment, it can be very broadly taken into our clinical practice. So in that sense, many of the yogas which we will be discussing here will be helpful for a general clinical practitioner to fasten their results and to deal with very complicated and acute conditions, basically. So not only in symptomatic management, but also in the broad spectrum or very specific conditions of the general practice, we can actually incorporate few of the ideas where the Agada Tantra text or Agada Tantra formulations will be telling us. So when we were actually having an opportunity to learn few of these formulations, our teachers or our guru used to tell that Agada Tantra is a specific area where you can actually see the doshas. So because in any of the other departments or other ashtangas, our interaction with the patient and patient's recovery will be in a slow pace, and there is no, for a new intern or for a new student, when they are seeing, it will be very difficult for them to actually visualize what is dosha and how it is coming up. What are the changes happening to the dosha with the treatments. But in Agada Tantra, what happens is, if you have a symptom, you have to give a medicine, and that has to be rectified. So there, very instantly, we can see the lakshana, we have to assume the nidana, we have to give the medicine, and the results has to be obtained. So a very cordial relation will be generated between the dosha and the physician. And in that sense, Agada is a peculiar subject where we can actually interact with the dosha. So in that sense, it has a very potent opportunity when we use these kind of yogas in our general practice. So just one more introduction to end this part. So I hope that these formulations what we will be going through might be useful for very senior clinicians who are not yet came across into the realm of this Prayoga Samuchaya or into the realm of Agada Tantra textbooks in that sense, because they are very senior, they will be very experienced. So when they get a glimpse of some theories or some practices, they can actually very elaborately use those portions into their clinical practice. And of course, for new drug development and even for literary research, because this one of the main issue what we face is this hasn't been translated to any of the other languages. It's available only in Malayalam, so that's a bit difficult part to reach this book into or this literature into other areas. So for literary work and of course for Ayurvedic enthusiasts to know that what can Ayurveda do with the general practice. So again, just a reminder, like we will be going through few of the yogas, and I hope that this won't be getting too dry, because it is only the yogas what we will be describing, and we will be describing the effect of those yogas and where it can be actually used and how experienced are the other Vaidyas with this yoga. So we will be very briefly, we'll just tell about what is Prayoga Samuchaya and where it is coming from. So as many of you might be knowing, VishaChikitsa or Agada Tantra has been a very active branch in Kerala and along with other Ashtangas, but this has been given a very importance, and there has been many books and many literature and many practitioners in the perspective of Agada Tantra. So basically, there are 3 textbooks which we consider as authentic regional language textbooks, still practiced by few of the Vaidyas, and those are actually Visha Chikitsa, Prayoga Samuchayam, and Kriya Kaumudi. So for the Kriya Kaumudi, which is the latest in the order, it has been written or rather it has been compiled from all the available textbooks. It's a very vast literature, and it's been published very recently. So it's not a very old text in that manner, but it's been a very vast, very large compilation basically. And Visha Chikitsa is the first among these 3 textbooks, 3 main textbooks, and Prayoga Samuchayam comes in between. So basically, it has been written by a traditional physician of Agada Tantra, who was actually from a royal Cochin dynasty, called as Kochuni Tamburan. So he was very famous for his Agada practice, and he was one of the first physician to establish an inpatient facility treatment center for snake bites and snake bite victims in Kerala when just after the independence. So there has been so many stories and so many clinical success stories about the author basically. So this book was written in 1934 to 35, that period. So it's not a very old book in that sense. Few of the portions which is in the book has been taken from the earlier books what we have been discussing, like the Visha, but there are few other yogas which cannot be seen anywhere else. So you can see the lineage of the Kochuni Tamburan basically. So all of those names what you can see, like Kokara Nambudiri or Kochuni Valiya Tamburan, they were their gurus, and they have a special lineage in their tradition. And this is published and republished with the commentary. And now the only available textbook of Agada Tantra in print in Malayalam is Prayoga Samuchaya. None of the other textbook what we discussed, it's not yet not available for print as of now, but Prayoga Samuchaya still has its copies. But as I said, it's only in Malayalam, so anybody is interested can actually work on a translation in that sense. So we won't go, as I told, we won't go in detail to the contents of that book in that sense. So it has Paricheda. Paricheda is just a translation for Adhyaya. So instead of Adhyaya, they have used the term as Paricheda. So there are 11 Parichedas, and it contains, as usual, it contains all the topics which is related to Agada Tantra. You can just go through these topics or Parichedas later when you have that time. So we will be sharing this. So I won't be going to the details of that. So now coming into the topic as such, we can see few of the prayogas in that sense, where they will be using medicines and they will be having their own specific method of utilizing that medicines, and there will be few yoga. So among them, I'll be going in chronological order from the first to the last, and won't be giving a dividing it according to the conditions or symptoms. So from first to last, we'll be just going through the text, only selecting the needed yogas. And one more thing to say, like few of the words what I use here, it's been coined or it's been typed by me or myself, because there is no other alternative words or alternative translations available. That's why I just might have created few words. So pardon for that. One of them is the blowing therapy. So in Malayalam, we call it as Uttu Chikitsa. Uttu is just blowing. So this is a very peculiar method of treatment, usually used in the treatment of snake bite victims. So basically, it is a symptomatic treatment where few of you might be knowing that we consider the Visha in Vegas. So in the primary 3 Vegas or primary 3 stages of intoxication, when the dosha are affected by the Visha in the very primary 3 stages, for example, Rasa, Rakta and Mamsa, there will be few symptoms of headache, few symptoms of heavy head, few symptoms of drooping of eyes, having sleepiness, or cannot be interacted with the outside world, will be going into the semi-conscious stage. So in such a scenario where there has been affected the primary 3 stages of the dhatus, these particular therapy is usually used. So as I said, this is been very widely used by many of the physicians, and we actually even use it in colleges for few other conditions rather than snake bite. Of course, we doesn't get the snake bite in that sense. So for other insect bites, if their hypersensitivity reactions are coming up and there is some involvement of neurological involvement is there, primary neurological involvement is there, then we can use it. Or even otherwise, for general practice, when the Urdhva Jatrugada Vikaras are coming up, just like Kapha Vada Pradhana, Urdhva Jatrugada Vikara, if they are coming, this particular treatment can be applied. So I'll just explain how or what it is basically. There are only 4 drugs basically. One is Vishwa, Dusparsha, Marija, and Vishavega. So again, we will be just going through the Sanskrit names of the drugs in that sense. And all these drugs are very common. When you, if at all anybody doesn't know this thing, you can just search it. It will be available. So in cases of few controversial or few uncommon drugs, I will be just explaining their botanical name as much as possible. So this is only 4 drugs: Vishwa, Dusparsha, Marija, and Vishavega. So usually what the Vaidyas do is they will take this drug, they will make the coarse powder of that, or just will pound that medicines, and they will be giving this to the attenders of the victim. Basically, in olden days, this medicine will be pounded and will be giving to the attendants of the patient, and they will chew it in their mouth, and they are asked to blow to the three places of the patient. One is the murdha and the two ears. So what happens is the virya of the or the potency of the medicine will be going into the patient through three of the marmasthanas. One is urdhva and two ears. So the attenders has to continuously blow with chewing this medicine, and they can actually spit out the whatever saliva is coming up, but they will be continuously doing it. So in reference, it is told that when you do it for 100 times, then the samyak lakshana or the time to stop that particular treatment has been arrived. So, but in practically what we do is when we get patients of vata kapha pradhana urdhajatru vikaras, when there is no association of pitta, very particular in that sense, this can aggravate pitta, it can aggravate the burning sensation all over the body. In such conditions, they can even go for a very semi-conscious or moha kind of scenario. So that has to be taken care. Otherwise, if there is heaviness of head, if there is severe headache, if there is tiredness, and there is heaviness from the top of the body to the site of the bite, then this treatment will be of great helpful. And it has been practiced, or rather it is very practically, it can be achieved. So this is one of the very basic, very starting treatment what many of the Visha Vaidyas in Kerala do, and many of the doctors even outside the Kerala, they have this practice. So the theory behind that, or the how it works, Siddhanta behind that, it is a different topic. So we will skip that portion in that sense. But you can just identify these drugs. You can have this, even not mandatory that even attenders has to do it. In colleges, we have the interns, we will make them to do, or even others, even doctors can actually do, attenders can do. So that's not a matter here. One thing which everybody should be taken care is when the attenders are doing, or whoever is doing, they should be devoid of use of alcohol for at least few hours before, and chewing of tobacco kind of things. So their mouth should be empty, clear, and then only they should be doing it. Otherwise, again, the involvement of pitta and other kind of issues can come up. Otherwise, it's a very potent therapy, which when we hear it for first time, even Ayurvedic doctors, if at all they are hearing it for first time, we will just neglect its probable efficacy, because it's just a external therapy, but very potent and very useful in such a scenario. So this is one of the thing. We can go to the, as I said, if at all you feel like having any discussions in between, I'm ready for that. I can have that. Otherwise, we will discuss it in the last. So coming to the second one, Ksheera Dhara. So basically, many of the medicines what we use here, or we see here, are medicines for complications of the snake bite, rather than actually treating the venom and snake bite, or in that sense for any bite. Many of the yogas what we see here, they are Vishahara, anti-poisonous, but are specified for some particular symptoms. So in that sense, we can actually incorporate these medicines, formulations, in treating such symptoms. So here we can see two yogas basically, but these two can be used as separate yogas, or even can be mixed up and used. So one is Kupilu Mula, which many of us will be familiar with using that Kupilu Mula for Ksheera Dhara. So I know we use it very generously. So it's a potent pain relieving mechanism or method of treatment. And even for Vata Kapha Pradhana Vikaras, we can actually use that treatment. But the formulation above that, Sariva, Vacha, Madhuga, Yashti Madhu, Chandana, and Ushira. So many of those formulations may not be having any names for that. It is just a sloga in that sense. So this is usually used in severe Pitta Pradhana Daha condition associated with any of the disease. So the cause is not a big deal here, but we can concentrate on the symptom, concentrate on the dosha, and actually we can utilize this to relieve the symptom. So Sariva, Vacha, Madhuga, Chandana, and Ushira, we can make it as a Ksheera, and if at all needed, severe pain is associated, Kupilu can also be included into the formulations, and we can do the Ksheera Dhara. So basically it is a neuralgia kind of pain or burning sensation kind of thing can be treated with this particular yoga. So, and again, except Kubilu, the other formulations from Sariva to Ushira, those formulations is said that it can be used as even Nasya or Pana. So the Kubilu has to be excluded. The other yoga, it can be used for Nasya and even for Pana. So again, it is being said in the Mandali Samanya Chikitsa. So Mandali is again a Pitta Pradhana Sarpa, where it has all the Paitika Lakshana, so you can just assume where this can be used. So just to comment on some other part, like whatever yogas we take here, as I said, the experience, I told that these are all yogas which has been proven by experience. So basically, when we go through the Prayoga Samuchaya, we can see few, for many of the yogas, they will be using exclamatory marks and the commas in that yoga. So it is said that these marks has been kept there only for those yogas which the author has used himself and found results. So rather than it's a very peculiar method of presentation in that sense. I haven't seen any other textbook having this criteria, where the author tells us that there are many yogas which has been in practice by many other physicians, but these specific yogas, it has been used by the author and has been found effective. So in that sense, the primary criteria was every yogas what we consider here are primarily experienced by the author, and then it is being experienced by not everything by me. Few of the yogas I used to practice. Otherwise, it is being experienced by the teachers or guru who has been explaining these things to me. So just to introduce that part into the discussion. So again, this is another yoga, Lodhradi or Lodhrashiradi. So Lodhradi, there is another yoga as Lodhradi Gana. So in primarily among the Vishavidyas, it is used to be Lodhradi, but nowadays, as it is being introduced into the clinics of many of the colleges and other things, now it is being told as Lodhrashiradi. So this loga is again from Prayoga Samuchaya itself. You can just see Lodhra, Shida, Nisha Yugma, Saralarkasa Vilyoga, Manjishta, Padali Mula Sameda, Ksheera. So it's again a very potent yoga to treat any Pitta Pradhana oozing lesions. I'm just avoiding the context of the VishaChikitsa here, and I'm coming only into the context of general practice. So any skin diseases in that sense where there is oozing, there is a srava, and associated with severe pitta and kapha, we can utilize this yoga for externally and even for internally. So there are few partha bhedas or few differences of opinion in the drugs used. So many of them, instead of padali, they use padha and nili. So you can assume the context of the yoga. It is Lodhra, Shida. Shida is Chandana and Nisha, Haridra. So both the varieties of Shida and Nisha has to be taken. Sarala, Arka, Vilya, Manjishta, Padali, or for in that sense, Padha or Nili instead of Padali can be taken. So again, this is again a potent yoga where psoriasis kind of or lesions where there is oozing, or even Visharchika kind of lesions or with spreaded all over the body, or if at all there is secondary infections again in the primary lesions or primary Visharchika lesions, dermatitis lesions, if at all there is secondary infections, bacterial infections, there is Paga happening. In that all conditions, actually this is a very potent yoga to use if at all there is association of kapha. So may not be a better yoga only for the severe pitta condition. If at all there is a association of kapha, Lodhrashiradi or Lodhradi yoga will be a great help. So it's been now very widely practiced in many even colleges and in many other Vaidyas. So the next one, we call it as Trimoorthi, or rather the textbook or the followers of the text call it as Trimoorthi, because it has only 3 drugs, Nimba, Neeli and Karanja. It's been mentioned in 2 areas in Prayoga Samuchaya. One is Mandali VishaChikitsa and the other one is Mushika. So both are, when you see, both are very opposite in nature. One is severely Pittaja in condition and the Mushika is extremely Kapha Pradhana in condition. So in both the scenario, this Trimurti, Nimba, Neeli and Karanja has been explained. So in clinical practice, when there is severe Utklesha on the base of Kapha, so Kapha Pradhana, Utklesha Pradhana diseases, whatever it is there, and that too Sama and spread all over the body. So there is association of the whole Sarvadehikas, whole body association is there. Sama Pradhana, there is Margavarodha, and there is association of Kapha and Pitta. In such conditions, you can use Nimba Nili Karanja as a single combination for symptomatic relief. Especially it is used in painful varicose ulcers or varicosity when causing the dermatitis, and there is pain, there is inflammations. In such conditions, even for internally and even for externally, for wash, shalana, you can use this medicine and it gives wonderful results. So especially in the symptom of pain related with varicose veins, it is a potent yoga and actually it can give wonderful results. So in other conditions, usually it works in urticaria type of lesions where the exact cause is not yet known, or we are fed up with giving all other medications. So at least for symptomatically, to treat that itching sensation, to treat that urticarial lesions, Nimbanili Karanja will be helping. I'm not telling that for every urticaria, Nimbanili Karanja will be the best option. I'm not telling that, but in some conditions where all other our armories are left out and we don't have a way to move forward. So in some conditions where there is again Utklesha is there, the patient should be having the bala to withstand this medicine because it's bit strong in that sense. Nimba is there in 1/3 part and Karanja again is 1/3. So all these drugs are very Shoshana Pradhana in nature, so should be very careful in using in such for patients who are very weak in that sense when Bela is not there. But otherwise, Nimbanili Karanja can be used in such scenarios also. So as I told, one is Mushika and the other one is Mandali, the context. So we can assume the dosha pradhanata of this Kashaya. So coming into another wonderful or what to say interesting area for Chardhi or for vomiting, because vomiting comes as a complication in Mandali Visha Chikitsa. When the patient is a victim of viper bites, common complication what happens to the patient is recurrent vomiting, by which we may not be able to introduce any kind of medicines into that patient, and we are left with no other choice. So in such scenarios, to address that symptom, only to that symptom, as I said, it doesn't have anything to do with the Visha in any way, but it tries to calm down the Vega. It tries to calm down the Chardhi as a symptom. So wherever in clinical practice we come across with Chardhi, not telling about very acute cases where there are specific reasons and very acute, for example, infectious conditions, or even for acute gastritis type of conditions or pancreatitis, or in such scenarios where we should be using our UT, leaving that part for any other continuous Chardhi, making the patient very dehydrated, and we want to just address that Chardhi, then symptomatically these few yogas can be used and it gives very wonderful results. Many of them are very simple yogas and few of them have been already used by many of you, but there are few conditions. So one is Dhanyaka, Villva and Jeeraga. So only 3 yogas: Dhanyaka, which is not powdered Dhanyaka but just the Dhanyaka itself, Villva and Jeeraga. So this has to be pounded and it has to be fried. Just dry fry it, adding nothing. Just fry it, and when it is hot in nature, just add narigalodaga or coconut water. Better to be tender coconut water. So only 3 drugs. Add narigalodaga when it is hot, and add sita. Just have it in, as we all know, the best time period of or Aushadha Kala for Visha is Muhurmuhu. So again for Chardhi it is Muhurmuhu. So have it in frequent timing with very little quantity. So half a teaspoon or 1 teaspoon or 2 teaspoon every 10 minutes or 5 minutes. Keep giving it. And for many of the patients, especially in IP patients where we have to deal with the recurrent Chardhi, when there is dehydration, especially for patients of children. So when they are affected with the Chardhi, this yoga will be of great help. So that is one thing. The other one is this, actually we use it in many areas, this Dhanyaka, Villu and Jeeraga. The other one is being said as a very potent yoga. I don't have a personal experience on that. So it is Amalaki, Pippali, Madhuga, Nagara along with Anjana. So here Anjana gives the importance to that yoga, and it has been used in many other conditions, many other areas for the Chardhi again and again. So Sita and Laja. So as I personally doesn't have any experience on that. It has been said as a wonderful yoga, so I just kept it here. So this one, the first one, Laja Chandana Ksheera. So this is again a wonderful way of administering the yogas in some different way. So what they are used to do is they will be doing the Ksheera of only Laja and Chandana. So again, Laja has been used many times in Chardhi for internally and for externally. So this is particularly a Ksheera made, will be applied as a paste over the chest. So it is to address that Vata Vega, basically to calm down the Vayu and to address that Vega itself. And it has been what to say, applied externally basically, because in many a times we may not be able to manage the condition of Chardhi by giving internal medicines, because again it keeps on vomiting out. So few techniques they used to do where the external treatment can somehow control the Chardhi Vega, and in that sense, internal medication can be continued. So this is again a very wonderful yoga used to give results, and only for the what to say, interest of trying out, we had tried out in few patients, but it is wonderful. So again, this can be actually used in many other conditions of Hikka or even Vada Pradhana Kasa kind of conditions, especially in when we are in admitting and treating the in IP patients. So Laja and Chandana, very simple yoga. Laja and Chandana, we will be making Ksheera into that, and the Ksheera has to be, or that paste has to be applied over the chest where that Udana Vayu is being affected. So similarly, the other one option is Bhoomyamalaki Rasa. So it has been told as a Egamulika Prayoga here. So here also it is not an internal medicine, it's an external application. Bhoomyamalaki Rasa has to be applied as a piju over the neck. So usually what they do is, I have seen it performing, but I haven't used it by myself. So Bhoomyamalaki Rasa, they will be making the Bhoomyamalaki Rasa, which is again may not be an easy thing for many of our practitioners in day-to-day practice. But Bhoomyamalaki Rasa, they will dip the cotton cloth into that and will be tying over the neck as a piju, or rather just tying all over the neck, and they will be keep applying that Bhoomyamalaki Rasa again and again, just as how we do the piju. So again, the mode of action, I'm not so sure about that. For Laja and Chandana Ksheera, we can actually assume what would be the mode of action. But for Bhoomyamalaki Rasa, it is, I'm not sure about how it works, but it works wonderfully. So these all are few alterations and thinking process where they used to manage the condition when the internal medicines are completely not working or cannot be used. So external applications has been selected. So these two yogas can be taken into consideration, and first yoga is very particularly useful. Before that, we just omitted two yogas, so you can just see that it is almost similar to the primary yoga, but for example, Laja, Nagara, Bala, Villu, and Dhanyaka. So maybe just like the Nayopayam Kashayam what we have, it is a just modified version of the Nayopayam Kashayam. It again has, when we say Chardhi here, we can consider all kind of Urdhva Jatrugada, Urdhva Vada Vikaras like Shwasa, Vadaja Shwasa, and Hikka, or even in some scenarios, even the affliction of the cardiac issues. So for example, when we say about Nayopayam Kashayam, the indications of Nayopayam Kashayam, you can just imagine. So in such scenarios, this can also be doing wonderful work. So go to the other one. Again, this has been explained as a Shwasahara Yoga basically, and Chardhighna, where the Darvigara Visha is being given as a cause of the Shwasa or the Chardhi. So in such scenario, this drug has been, or this formulation has been explained as Villumula, Drona Pushpi, Shalaparni, Apamarga, Ajamoda, and Nagara. You can just see. So it's almost, we can use it as Nayopayam in a more Kapha Pradhana condition. It removes the Kapha Varna, it opens up the Vayu, Urdhva Vayu, Anulomya will be given by this yoga. So again, it can be used as a yoga for Kasa, that too particularly towards the Vata Kapha Pradhana, and even in Chardhi also. So again, coming into another complication of the usual complication of the Mandali Visha. So bleeding is the most common severe complication we come across with Mandali Visha. There are so many yogas explained specifically for bleeding. So again, as I was telling, bleeding. So Vadankura, Bala, Vasha, and Ushira. So we usually use it for the menstrual bleeding and for the excessive bleeding, uterine bleeding, etc. It works very wonderful in that sense. So again, this has to be explained, like for urinary obstruction, any kind of urinary obstructions, even for because of the palsy or any other condition, usually it is a complication of the Mandali Visha. But Kushmandalata, so we have to, the ashgard stem has to be taken, Kashaya is made, and along with cardamom, it gives wonderful result in generating the urine and removing that urinary obstruction. So the second yoga also, this is a very important yoga, maybe one of the most practically usable yoga in the whole presentation. So this can be taken note of. So Kottamtagaradi, again, it is a yoga explained for Luda Visha and Mandali Visha also. So for neuralgic pains, neuralgia conditions, for post-herpes pain, Kottamtagaradi works wonderful. Basically, it is a yoga which is Pittahara in nature and Vadahara. So Vada Pittahara, when the base of the Samprapti is Vada Pradhana, but there is involvement of Pitta. In such scenarios, Kottamtagaradi will be working wonderful. So again, Shophahara. So I am not explaining that because it has been available, so you can just refer that. This Arka Patra Sweda, if at all anybody is not aware of that, it is a wonderful yoga for reducing the swelling and reducing the pain, specifically inflammatory pain. When there is no involvement of active pitta in that sense, it has been explained as a Vedanahara yoga for Darvikara Visha. It can be used in any kind of poison or non-poisonous condition where there is active inflammatory pain is there. Just taking the Arkapatra, dipping in hot ghee and using it for Lepa or using it for Kiri, for example, for Swedana. So basically what we need is we have to use the Arkapatra for Swedana and that too in hot ghee. So there is a method of doing that. Maybe we can discuss that. So this is again a very wonderful yoga, very, very effective, and the results will be in minutes. This is, you might be knowing about the Amrutotharam. So this is almost similar like Amrutotharam. Instead of Amrita, there is Punarnava. It can be used in multiple conditions where Shophahara is needed rather than the Juraharatva. The Punarnava, Haridaki and Nagara has been explained as a wonderful drug for joint involvement of when Visha is lodged in joints and causing Sada. So Sandhi Sada has been explained as a very specific indication for this yoga. So Amukkara Vayambadi, again, these all are very, very potent yogas which can be used in practice. Again, those who are not familiar with this one, there are publications available. You can just go through Jeevarakshaka Gulika, one of the very potent and primary medicines used in actual VishaChikitsa, but in general practice, actually, we can use it as a Rasayana yoga for many autoimmune conditions and many diabetic foot ulcers kind of conditions where Shodha is needed and Rakta Prasadana is needed. So Ksheera has been given us the Anubana. The details can be available even in publication. So, but this is a very important yoga, very potent yoga, but it's not in market basically, but it can be taken into consideration. And if at all any further clarifications or doubts are there, I will be happy to introduce maybe few more yogas if necessary.
Thank you, Dr. Vishnu. So that was a mind-blowing session. Overall, see, the basic idea was to introduce the important formulations from this text, where basically these formulations, what Dr. Vishnu explained, are focused towards the treatment of different types of Visha. So, and also he was mentioning, so Visha, maybe Sarpa Visha, Musika Visha, Luta Visha, so many types of Visha. So like insects, spiders, so for those who cannot understand the traditional words, snake, scorpion, and lot more things. The basic idea was not to explain about how these formulations are working in the treatment of poisons or poison bites or stings. The basic idea was to look at those formulations from a different angle, different perspective, where the same formulations can be carried to the generalized practice. Like example, Dr. Jishnu, if I'm not wrong, explained a few formulations which are used in Chardhi, that is vomiting, acute and chronic vomiting, and vomiting which is not getting responded to any medications. So here, the formulation which is explained as a treatment of vomiting as a complication for a snake bite or something, that can also be inculcated into the practice to control uncontrolled vomiting and other conditions. Another condition like for excessive menstrual bleeding that was also Dr. Jishnu mentioning. So these are the examples. I'm just giving the perspective to sum up the discussion. Is to use the formulations are used in a different context, but what we are seeing here is how to use the same formulations in the clinical practice for general conditions, what we see in the OPD and IPD. So hopefully I'm not wrong, Dr. Jishnu.
Yeah, okay. Exactly, sir, exactly.
Exactly. So that was the basic idea. So again, thanks on behalf of all of us. This is not a vote of thanks for introducing us to a new treatise, new book, and new formulations which were unheard of, and giving a different perspective and dimension that so we can get these formulations into the practice, though not mentioned in the other treatises, and they're also practice oriented and which have come out of the experience, as Dr. Jishnu rightly pointed out. The author himself has made a mark, note mark and a foot mark there that I have used them in the clinical practice. You too can go ahead and practice them. How much courage is needed for a VishaChikitsa? So because one question I want to ask you, you can keep your answers in brief because we have a few questions in the question box. What made you to take Agada Tantra as we know, as you mentioned in one of your statements that Kerala traditional practice also focuses on VishaChikitsa. There are so many VishaChikitsaks there. What generated an interest in you to go ahead and take Agada Tantra as a specialization? Because many students would be looking at some clinical subjects like Kaya Chikitsa, Shalya, Shalakya. So generally when we ask, nowadays kids are courageous to tell different subjects. Agada Tantra, I think many people are taking now, but still people might hesitate to venture into that area, thinking that a post-graduation or a PhD or any degree, a higher degree in Agada Tantra may not give us a recognition as a successful practitioner, or the area of practice will be limited to Visha. Idea confined in the minds of the youngsters. So what's your take on this, and why Dr. Jishnu ventured into Agada Tantra?
As you rightly said, sir, it's very lot of courage is needed actually to practice. So basically, I think that is the reason why this topic has been introduced in this sense. Otherwise, I would have been explaining about the VishaChikitsa basically. But unfortunately, we have to mention it in a little deviated way that these yogas can be used in general practice, because we don't get enough support or courage, or there is no experience before us in practicing this in VishaChikitsa where it is actually indicated. So in that sense itself, it is very difficult for a Ayurvedic physician at this current situation to practice Agada Tantra. But when you ask about my personal this thing, maybe I just wanted to study the base of Ayurveda, the Ashtanga Hridaya in its original sense, in original style. And I went out searching for somebody, and I landed in an area where they used to teach the Ashtanga Hridaya, but they were Agada practitioner in that sense. So I have been there for a few years. So after that, I have been seeing the cases, and then I went to the Agada, PG in that sense. So it was just accidental to select, but yes, it needs very big courage. And I'm not a Agada practitioner in that sense, not at all.
Yeah, so that's a clean statement there, and also an honest reply by Dr. Jishnu. What took him into this particular area and exploring it? So a few more questions. Swapnaji has a question here. Is Vishwa ginger? So that's what exactly you meant. I understand Dusparsha as Mithuna. Is it the Dusparsha you mentioned? Maricha as black pepper, Vishavega as Ishwari. Please correct me if
it is exactly.
Okay, Dusparsha is as in Mukuna you have used, like Kapikachu.
Yes.
Okay, Maricha is black pepper and Vishavega is Ishwari.
Ishwaramuli, Aristologia.
Yeah. Swapnaji, again, I did not understand the blowing procedure. Are there any pictures? Thanks is from Swapnaji. I'll add a question to that, Dr. Jishnu. So while explaining the blowing therapy, you also mentioned that it is blown over the head and also into the ears, like Marmasthana. So how is it? Why is it important to blow over the head and ears? Number one. And the mode of action. So like, is it absorbed and is it applicable in all types of poisonings? And so how do you connect it to the general practice? Like this formulation, you are very much emphasizing as one of the most successful practices, and it should be done over 100 times.
Yeah, the one thing is over the 100 times is just a mentioning of the text, so that can be, of course, it can be changed. So one part is that. The other part is actually it is How it is working is again a theoretical question which we have to find out an answer. But I think specifically it is what to say, concentrating on the marma pradeshas, as how we use the tala or the pichu or the shiras. Shiras is a marma sthana, and the virya of the drug here is being transformed or is being translated through the maybe Akasha Mahabodha in that sense. And when you see the ear as a indriya, again it has connections with Akasha. So when we think about that, when you go in areas of height or even flight, we know how important it is to have that balance of the ear in such scenario. So when there is continuous blowing into that area, that too with the virya of the drug, it actually enters to the area where it has to enter to correct that symptom. So basically, it is giving the virya of the drug through Akasha Mahabodha to the specific area. Why I emphasized on that is even when I heard it for the first time, we were not at all sure about how it actually works, and I thought it won't be working. But to my amusement, actually, for every patient who used to do this, it gives wonderful result. We can see it in minutes of time, maybe 5 minutes, 10 minutes. They'll be having the whole heaviness of the body, whole pain over the body. So it's literally it starts coming down. As we introduce the virya of the medicine over that area, it starts coming down, and the patient will himself or herself will be telling that, yeah, now I feel lighter on my upper part. So it comes down and it subsides. So in that sense, it is very wonderful, this thing. And in general practice, basically, when I use it only to the VishaChikitsa. Basically, when there is stings of bee sting, we used to get very often bee sting because the campus is such a scenario. So when that happens and there is an involvement of shiras and there is an involvement of kapha pradhana vikaras, their heaviness, headache, this works wonderfully. So when there is involvement of kapha in the rasa rakta level, I think this will be working in general practice also for the heavy head, for the neurological involvement in some scenarios. But in general practice, I haven't used it in that sense. But in acute conditions of poisonous bite, stings, it works.
Oh, absolutely amazing. This formulation, the blowing therapy is, Dr. Jishnu. Again, as I said right at the beginning, it needs a lot of courage for the physician to practice VishaChikitsa. And see, Kerala, the region itself known for, so there is also a trust factor, I believe, between the physician, traditional physicians, and also the patients. So otherwise, as you said, when we hear or when we come through these formulations or the procedures for the first time, it gives a big query in the minds of us. So I too was thinking like, so not like, will it really work? Is it a big risk of doing that? So because, so general notion is people will be scared of poisoning, and they might think that taking a blowing therapy might be a risk. So that might come into the mind. And as you said, you have personally witnessed those results. So that's really amazing, and it requires a confidence on the perspective of physician and also the patient. So they should be knowing the treatment culture. So like how these things have been handled, and we definitely have results. And word of mouth, and definitely people will be flocking to, because they know that there are. So we also note that other measures to handle with the acute poison or poisoning conditions are very difficult. Added to this, I'll come back to one more question. So before that, we will take Swapnaji's question. Once again, I understand Kandu and Shota, Shwet, Chardi are Kapha symptoms. Swapnaji wants to know what other Kapha symptoms are available in Visha other than Kandu and Shota and Chardi.
Kapha symptoms, very acute and very strong. Breathlessness can be associated with many of the bites. For example, in crate bite, the death happens because of the obstruction of the Shwasa processes. So recurrent and continuous coming up of phlegm is a very acute condition in such scenarios. So it leaves no area for us to intervene into such scenarios. So that is a symptom. For simple example, the heaviness of the body, as I said, where the blowing therapy is working fantastically. Severe heaviness of the body, head pain. So these are usually the kapha symptoms which comes. And feeling of shivering. So usually that also happens. So feverishness and feeling of shivering, coldness, it all associated at some point or the other time along with the bite. So one more thing just to add, rather than doing and going for the exact blowing therapy in that sense, the importance may be to understand that such as mechanism of administration of drug is also possible. So in that sense, that can be researched upon, or that can be taken into consideration. Many other modulations of drug, introduction can be thought of. So rather, as you were rightly saying, to why we should be going for a blowing therapy when we have other options to treat these acute conditions. That is an exact point. But rather than that, I wanted to say that such a scenario or such a method of drug introduction is also possible. So reason behind that can be thought upon, and that can be introduced into other practices also.
Absolutely, that is a fantastic link to that. And the basic idea behind this presentation and also this topic is to inculcate this. So as even the blowing therapy, not only in the VishaChikitsa, as Dr. Vishnu has been telling, so we can think over that particular pathway of administration of medicines in other conditions also. So like it gives scope. If this is working in Visha, so if can we just go ahead and experiment on few other classical medications and try and see if they really work in other conditions similar to these conditions. So we need to see the structure and also the pathway into which we are moving, adapting the same principles in the clinical practice while treating the other diseases on the basis of what has been explained for VishaChikitsa. I think that's a wonderful link. And quantities of dravyas used in, you explained some Chardhi formulations, Dr. Vishnu. Swapnaji was interested to know like what should be the quantities, whether it is equal proportions or how do we use that?
Yeah. There are only few yogas or formulations which we had given the exact quantity. Otherwise, it is on equal quantity and how much content of the medicine you are looking into. So depending on that, equal quantity of medicines can be taken. So there is no other peculiar demarcation given in that sense. So only for the last few yogas like Mrta Sanjeevani or the Jeevaraksha kind of drugs which has contents of rasa, for that exact measurement has been given. Otherwise, for all other herbal drugs, usually there doesn't give proportion. So it's equal in quantity, basically.
Equal. Unless otherwise specified, we should be taking in equal quantities. Thank you, that. And again, coming with Swapnaji's question, Arka should be avoided in Pitta conditions. Okay. Just wondering about Pravada Panchamrita Ras has been used in mouth ulcers, right? I did not find the link here. I wish you continue all these wonderful prayogas in another session. Thanks much. That's a compliment.
So I'm wondering, like, if it's Arka is avoided in Pitta conditions, how come it's been used in Praval Panchamrit, which is a Pitta condition? So just to clarify that, can it be used or no in Pitta conditions?
Arka, basically, I think I was telling about the Arka Sweda. I think that was the context here. So am I right, Swapnaji?
Yes, sir.
Yeah. So basically what happens is Arka Patra Sweda, as we know, it is about the Sweda procedure, one thing. And the other thing, we use it for acute pain, basically. So it is a symptomatic treatment to relieve the pain. So when there is Vata and Vata Kapha association of Vata, this Arkapatra Sweda is very particularly effective. If at all there is an involvement of Pitta, for example, there is tenderness, there is severe swelling is there, inflammatory changes are there, which is about to get Paga, then Arkapatra Sweda is contraindicated. Maybe it's more than Arkapatra Sweda, it is the Sweda itself is contraindicated. So I think my context was related to Sweda by Arkapatra.
So in a context, it was mentioned as vitiated doshas and the Sama conditions where the Kashaya Pana was advised. Why don't we opt for Vamana in that case rather than wait for a complete digestion of the Kashaya?
I think if I am getting it right, Vamana can be advised. There is no problem in that, or there is no discussion in that. It can be advised. When there is Sama, there might be conditions where Vamana is contraindicated, especially when we are dealing with Visha. Of course, there will be conditions where even Vamana is not at all involved, but we are not dealing with that. We will be coming only to the general practice. Even in such scenarios where Vamana is contraindicated, Vamana cannot be done, and we need some Pachana to happen in systemic conditions, then of course this can be done. And again, the Sama condition may not be spread all over the body. Maybe the Amatwa will in example, like in many of the skin conditions, in Visha like conditions, there can be involvement of Samarasa in localized areas where we may have to do the pachana of that dosha. So in such scenarios, this will be useful. And of course, Vamana can be an added option. Vamana, rather than added option, that would be the primary or first line of treatment option. And maybe you can go for the other kind of pachana dravyas. I hope
I think
whatever the context you have raised, it is a valid thing. It can be thought in that terms
I
also.
think Dr. Vishnupriya's question has been answered, and before we conclude this session, one question from me, like a conclusive question to Dr. Jishnu. So, with your experience in handling the VishaChikitsa and also the VishaChikitsa formulations in the clinical practice, my question here, added question to this is, Dr. Jishnu, while appreciating your presentation, see, nowadays all of us are affected with, so we will leave apart the poisons like sarpa or vrishchika, Ludha, all those things. So we are in an era where we consume a lot of foods itself which get converted into toxins, like even ama visha, so many things we speak about. And the long-standing thing and viruddhaharas, all those things leads to so many systemic problems, lifestyle disorders and other things. Even in these conditions where Visha not actually taking from the Agada perspective, so what we are speaking today, thinking that one or the other quantum of Visha is available in our system because we are exposed to such a lifestyle, food practices, knowingly or unknowingly. So it need not be essentially a prajna parada. So, but we are consuming certain things, export to certain things that poisons or the, I'm not using the word poisons here, the Visha is developed in our system unknowingly. So maybe a manasika Visha also due to stress and other things. Okay, manasika ama we know. So like, so this ama and also the toxins, certain toxins which are formed within us while being in a modern era. Do you think this session conclusion statement we can make, or a statement with a query or a conclusive statement that many formulations explained in Agada Tantra and wonderful treatises like you touched upon today, Prayoga Samuchaya and other texts, can they be brought into the general practice? That was the basic idea. So like handling the regular general conditions like Jwara, Charti, Atisara, so Grahini, Amavata, Amavisha, and certain other conditions which are caused due to the impact of life, lifestyle, foods, and all those things. The VishaChikitsa can be skillfully implemented in treating the generalized conditions which come into our clinical practice, number one. And when traditional formulations treating those conditions fail, we can have a perspective and look at VishaChikitsa and use them as the medicines for chronic conditions and also as an emergency cure. So this was a big question.
Yeah, exactly, sir. That would be the perfect closing or the conclusion statement to make. Basically, as you said rightly, there are two aspects of utilizing of these Visha Yogas. One is for acute management of a symptom which is coming in general practice, and the other one is treating the actual cause of a chronic disorder. So as I was just going through the yogas like the Jeevarakshaka Gulika, it has a very wonderful effects in treating many of the autoimmune conditions, not specifically treated by me, but there has been doctors who uses this particular medicine for different kind of autoimmune conditions, and many other yogas which is being mentioned as Hridaya yogas. It can be used as a Hridayavarana, which, or rather we can use it as a Hridayavarana, and there is a wide scope for preventive medicine, and there is a wide scope for eliminating the whatever inflammatory responses what we will be having in the modern day life, and the concept of Dushi Visha will be of a great importance when we and can be managed with this many of those yogas. So as you were saying about the psychological involvement, there are actually two yogas which I have included in the slide, but I couldn't explain that. So which contains actually yogas which calms down the mind, which have a very important result in treating psoriasis kind of conditions where there is psychological involvement. I'm saying that because that was the condition which we used. So similarly, that can be taken into other contexts, and we can utilize these yogas in various other conditions. So basically what happens is many of the drugs what we use here, it has potential Vishaharatva in its prabhava or in its karma. Other than the Doshaharatva of these peculiar drugs, it has an Vishaharatva also. So that adds as a extra force in making that formulation. So it will be wonderful when we can utilize these drugs into our common practice. So basically, the concept of Dushi Visha can be taken, and these yogas and these concepts can be incorporated so that one, a fast relief, the other one, a better relief in the chronic conditions in treating the root cause can be achieved, I feel. So that is an area where we have to work upon. So maybe the concept of Agada Tantra will in future will be, if it all coming up nicely, it will be helping this context rather than the acute management, as far as I understand, because that part has been very, of course, in modern era, it has been reached somewhere else where reaching to that point is very difficult for us at right this time. But the other area, it is very, very open. Still, we have so much of thing to try out and do. So, of course, that is a wonderful concept to conclude the total session, I feel.
Thank you, Dr. Jishnu, for making the conclusive statement. And also, as I said, this session was really mind-blowing. I think even our participants would agree. So on behalf of all our participants and Easy Ayurveda, so big thanks to Dr. Jishnu Narayanan for giving us a wonderful talk and presenting us with a new, introducing us and presenting us with a very innovative and very interesting and mind-blowing and mind-opening session. Thank you, Dr. Vishnu Narayanan, on behalf of all of us.
Thank you so much, sir. Thank you, and thank you, Easy Ayurveda, once again.
Before concluding the session, a small announcement that most of you know. So Easy Ayurveda is coming up with a hospital, a big structured hospital at Mangaluru on October 22nd. So need all your wishes for the successful run of the hospital. We are venturing into that also as team Easy Ayurveda. So that celebrative moment is also your celebrative moment because you are always with us. Thanks for the support. So as from all of you, and a lot of love from all of you, as it has always been. A big thank you, namaste, and loads of love from Easy Ayurveda to all of you. Namaste.